I think healthcare professionals have responded to the pandemic really in the way that we expected them all to. In that I find that healthcare professionals are generally quite passionate about what they do, care about their patients, care about their team, and are often by their very nature quite adaptable. I think as the pandemic declared itself and it became apparent that we needed to rapidly either upskill or completely modify the way we worked, the way we thought, the way we ran our service, the way we took care of our patients, what was fantastic was globally, really, but certainly in the UK, healthcare professionals at all levels very much just rallied. And it highlighted some of the things we do really well. It highlighted the interprofessional learning and working that we do day in, day out anyway. It highlighted the strength of the teams we work in. And it highlighted nearly everyone's willingness to roll up their sleeves and get stuck in for their patients. Whether that meant that you have a professor carrying boxes because that's what you need them to do that day, or a medical student leading the team because actually they're the best informed. So yeah, I would say that the healthcare professionals on the whole have made us all pretty proud.
I'll go ahead and introduce myself and give my first thoughts. So I'm Zach West. I'm a first-year pediatric resident at Emory University in Atlanta, Georgia. And in these last few months, medical students have stepped up in big ways to support healthcare and even take on professional roles themselves. So I started APL co-considering to provide volunteer babysitting to healthcare workers, which turned out to be very successful, especially in the beginning when there was a lot of flux in terms of childcare, and we were able to step in and let the professionals focus on their work and take care of the patients, especially when we had a large increase in population at the beginning. And then as medical students, normally we volunteer to attend a volunteer clinic at a local healthcare facility, treating patients in a lower income neighborhood, typically refugees. But during COVID, of course, we couldn't participate. But they had applied and received funding to conduct COVID tests. So they reached out to us, to medical students, including myself, to organize a callback system for patients who did not have primary care doctors. And then the local health department also asked for us to perform contact tracing on these patients. So I researched and worked with a group of students to put together a contact tracing playbook that we are working with the local health department to implement and follow up on these patients. So you can see that medical students are not just medical students. You know, as some people get in their mind, it's hard to have to avoid this imposter syndrome. But we can really take initiative and step up in big ways.
If Animator would like to introduce herself from Delhi.
Thank you for this opportunity. Disease early and bad. Our hospital, tertiary care hospital, and a premier medical institution. So, as India is also our hospital has catered to nearly 1,500 COVID patients.
Put me on mute.
Residents and below the hospital assistants, the security guards, everybody has been involved, and as a united when the virus stuck in Wuhan, it was more of an academic COVID-19 pandemic. We weren't doing our hospital caters nearly
Of a poor connection on that front. I wonder if Animator joins through audio, the audio might be clearer. If we can bring Animator on the screen through audio. Okay. In the meanwhile, if we can ask Mr. Jeremy Ward to give us his thoughts. So if you just unmute yourself before speaking, you can see your office.
I'm sorry, could you hear me? I think the connection got lost.
Great, you're back. We can hear you very clearly.
Can you hear me now?
Yes, absolutely. Absolutely.
Yeah. Okay. So what I was telling was that after Italy's experience, we guys were frightened by the amount of patients that we actually see every day. And despite all our efforts, it is impossible for us to admit all of these. So we decided to prepare a task force team. So this team basically comprised of all the various stakeholders of our hospital, headed by the internal medicine head of the department and the director. And the best part about this team was that it included residents like us. It included infectious disease fellows. It included internal medicine, pulmonology, and fellows from various departments. Now, what this team did was it went through from ground level till the administrative level to mitigate all the challenges that are coming in our way. So as our floodgates opened, we faced various challenges at every day, and it was humongous to segregate these suspected COVID patients and the SARI patients from the rest of the patients. What used to happen was there used to be accidental exposures in the hospital, which used to cause the contact tracing team running on their toes and trying to find out the high-risk contacts and quarantining them. And there were times when the whole wards were quarantined. The patients, the healthcare staff, the nurses, everybody was quarantined. So subsequently, we started to have this shortage of all these healthcare workers. There was so much quarantine happening that we didn't know who could continue to work and who could come back from work from quarantine. And unfortunately, because of lack of resources and lack of staff, we had to narrow down this window of the quarantine period. Then another task that we were facing was the global shortage of the personal protective equipment. The healthcare workers were not just trembling with fear and how to make do with the long shifts, but also being a tropical country, fighting the heat with nearly plastic and those inappropriate PPE was very difficult. So whether not to use a washroom, how to eat, how to drink, there were so many of my colleagues who actually had a syncopal attack and fainted while working in the duty hours because of dehydration. So despite of all these extreme conditions, I feel our healthcare workers and the residents, the nurses everywhere, they've not lost the zeal to fight. Our residents association, colleagues, family, friends, and even to that matter, the government have been taking various steps to keep us motivated, keep elevating our fears, trying to do things to help us continue fighting. So we ended up repurposing a lot of hospitals blocks, like our trauma emergency was repurposed into a complete COVID hospital. Our OPDs were repurposed into mass screening areas where we performed testing through those window kiosk systems, if you might have seen from Korea. Then we made holding areas in our hospital for the patients who were awaiting test results. So what has helped us through is this network of infectious disease colleagues who are in various states. And we've been keeping in touch with them every day, and they've been sharing their experiences. So that's how we are getting an idea about how this pandemic might unfold in our city. What are the challenges which are ahead of us, which we might be facing in our hospital, and what all we need to do. For example, my senior colleague in Mumbai gave us a heads up that, there are a lot of patients and they're going to be increasing and you need more oxygen supplies in the hospital. So that's when we troubleshooted. We went to the hospital administration and we asked for increased manifolds in our hospital and to increase beds with oxygen supplies as compared to what it was previously. So with time, unfortunately, many healthcare workers started to test positive. There were so many non-COVID wards, which started testing positive. Our contact tracing team found it almost impossible to keep contacting. So I feel currently we are all at a war footing at whatever state, whatever country that we belong. And all we can do is look forward and look up to the strategies that other countries are applying, which might help us. So even though we guys have not achieved its peak yet and we are exponentially rising, I feel as a medical fraternity, sharing each other's experience, preparing ourselves early, and most importantly, keeping the morale of the frontline workers to keep fighting this battle is the need of the hour. So I think this platform is an excellent idea for us to share our experiences and to keep going. Thank you.
Thanks very much for that, Animator. I think it was a very in-depth and reflective kind of sharing of your experiences at AIMS in Delhi. And I actually did my medical school elective at AIMS, and I know how big an institution it really is. It's so many thousands. I think it's the busiest hospital in Asia, if I'm not mistaken. So hats off to you and the whole team there, supporting the efforts against this pandemic. If we can ask Mr. Jeremy Ward, we can see you nice and clearly. If you just unmute, if you just click on the unmute button on the screen. So on your screen, Jeremy, there'll be at the bottom, there'll be a button that says mute. If you can click on unmute. Well, allow Jeremy to work that out, and we'll be supporting that from the tech side. Dom, if you want to give us an introduction and your thoughts on how you've been supporting the current pandemic.
Yeah, absolutely. So as you mentioned, I'm Dom. I'm one of the interim F1s working at doing general surgery at the moment. And I think the panel have usually summarised the way in which they responded to them. A few things that have mainly struck me have been, first of all, a willingness to help. I know we were sort of in about 3 days' notice between actually being informed we had jobs and starting. And I know that there was no delay from anyone in getting all that paperwork done. But also, at the in Exeter, there were many of us graduated. There weren't actually the number of posts for everyone to receive an F1 course. But there are also next to a number of paid positions that medical students can take up. And then they've been absolutely inundated with people looking to pick up shifts and sort of get involved with the effort. And the second thing that's really struck me about the training response is a kind of the feeling of togetherness. Maybe slightly because a lot of the people, all of the F1s were my cohort in medical school because I intercalated and didn't. But it's been a fantastic atmosphere to work in. And also because we are so new and have graduated a few months earlier, we do require the level of supervision, which in my experience, all of the colleagues have been more than happy to facilitate as well. It's been fantastic.
Thanks, Dom. Really insightful. And I think, as you say, the rapid deployment of final year medical students away from their summer holidays that they would have spent in lockdown onto the front line, I think has been, hats off to the General Medical Council. We actually held a national Twitter chat with Colin Melville, who is the Medical Director and Director of Education at the GMC, before the redeployment to air some of the concerns that final year medical students felt, but also how we could go about this in the safest manner. Jeremy, I think you're on mute now. If you can try and say hi. Jeremy, if you say hi, Jeremy, I think we'll be able to hear you.
Mr. Ward, if you could go ahead and introduce yourself.
Hi, thanks. Yeah, sorry. Good morning, good afternoon, everybody. I couldn't hear Raj in the studio at all there, I'm afraid. I'd like to thank you for the opportunity to come and contribute today. I'm a general and upper gastrointestinal surgeon up in Preston in the northwest of England. That's north of Liverpool and Manchester and south of the Lake District. for those of you who know that part of the world. I guess I think I echo Simon's comments about how healthcare professionals have responded to the COVID pandemic. Obviously, it brought in huge changes incredibly quickly with regard to our practices, with regard to patients' flows, patient pathways, all the constantly changing recommendations with regard to PPE and donning and doffing, and the way that teams came together to adapt to those changes and are still adapting as we come out of the pandemic to some of the changes which will be with us for a long time, I think has been the most remarkable aspect of the response and the clinical leadership that's been shown across the board. From my perspective, our own practice actually within surgery reduced for a period of time with a reduction in both emergency and cancer surgery. But we did spend a lot of time in simulation training and simulation practice with colleagues both in theatre to talk through and walk through the new theatre processes which we had to adopt. And those are changing again as we come out of the pandemic. And again on the wards for even relatively simple processes, which was new to everybody. Everybody had their own ideas, so it was very helpful to come to a new standardised process. And I think that's been the most important aspect of the process for me, and also in helping design new ultra green pathways, if you like, as we try and come out of the pandemic and get our elective surgery going. There's clearly been a lot of other advances that happen more quickly than the NHS is used to, such as remote consultations and things like that to help practice for the future.
Thanks very much. So I guess there's already a lot of thoughts there in terms of how we've all adapted in our systems. I guess one of the questions that has emerged really has been around the well-being, mental health, but the support available to healthcare professionals on the front line. But of course, it's not just about the language around front line and fighting COVID, but actually how our colleagues who might not be able to support things clinically, who might be shielding, how they're also supporting efforts. And I know there's already been a lot of discussion around risk assessment, which we'll be talking about later as well during the diversity session with Professor Bamra and Dr. Kailash Chand for the society panel. But do we feel that healthcare professionals have enough support in order to really give their best and respond to the pandemic? I wonder if we can start with Simon on that.
Raj, that's a great question about whether healthcare professionals have enough support. I think COVID has highlighted the importance of well-being, and well-being in the real sense of the word. This is not mandatory yoga before you start work or having to do 5 hours of e-learning to confirm that you are resilient. It is about meaningful, pragmatic, real-world solutions to allow healthcare professionals to work in what is an environment nearly all of us are unprepared for. At the Nightingale Hospital in London, which I was involved in, healthcare and staff well-being was one of our primary focuses throughout the induction, throughout training, and throughout the service that we offered. And it was because for the first time, it was explicitly said that if you don't take care of your staff, you can't deliver healthcare, and that actually self-care is healthcare. And if you think about pre-COVID, if anyone can remember what that world even looked like, certainly the NHS was on the verge of burnout. It was at breaking point. And if you look at where burnout and those sort of problems come from, they come from people feeling unsupported, unvalued, people feeling like they have to be perfect, like there's no space for making mistakes or learning or being anything less than 100% all the time, even to the point of the fact that we know that fatigue is the #1 indicator for burnout. And so when you ask the question, is there enough support? I would say no. If I'm honest, I think we haven't got it right yet in healthcare, how we support ourselves and how we support the people next to us. But I think what COVID has forced us to do is re-examine what that looks like going forward. Because if we want the healthcare workforce to both keep managing COVID, manage all the stuff that's just waiting for us because we've had to put things on hold, put things on pause, all of the, I want to say new pathologies, new pathologies that many of us have not seen or haven't seen in a while because people have been at home, not presenting, had their investigations or procedures delayed. We're going to have to build a framework by which we, as a profession, normalize taking care of ourselves and taking care of others. It can't be seen as weak or wishy-washy or touchy-feely, because otherwise we will see a increase in the rates of burnout, mental health problems, PTSD, all those things that COVID acutely has forced us to be aware of and try and manage. So do I think there's enough support? No. Do I actually think it's better than it was before COVID? Yes. But do we need to do better going forward? Undeniably.
Thanks, Simon. I can't say I totally agree with what you've just raised there. And I think it's amazing how a lot of the facilities and support that was available in the past, for example, doctors' messes, are now giving the spotlight that they deserve. And some of the things that, you know, people think that healthcare professionals take for granted or have access to, but actually don't have access to some of the basic things. It'd be good to get your insights on that, Animator, from the Indian perspective as well around the support. I know you mentioned the government of India and the hospitals have been very supportive, but I wonder what that feels like on the ground.
So, as I completely agree with what Simon has just said, I mean, these are completely challenging times. None of us has ever faced something like this before. And more than anything else, it's pushing all of us to our limits of extreme physical strength, mental strength, patience. And so I belong to a family of 4 doctors, my parents and my sister, all 4 doctors. All 4 of us are going to 4 different hospitals. And the fear of meeting my own parents, the fear of meeting and eating dinner with them, I cannot describe it to you. No matter how educated we end up being, no matter how aware we are, no matter how many precautions we take, we are afraid of meeting our relatives. We don't want to give the infection to them. We see and hear about healthcare professionals dying, losing their lives. So I don't think it's wrong on calling it frontline warriors or soldiers. I think as doctors or any healthcare professionals, we had not signed for working and giving away our lives. So it is brought down to extreme, and I think as a doctor, I have never felt more honored and never felt that this is more a noble profession ever before, because the extreme enthusiasm that everybody is showing despite of seeing the results of healthcare workers getting involved, it's amazing. So I think what our hospital is trying to do is narrate the stories of the warriors, or so to say, the healthcare workers who tested positive and recovered and fought back stronger. They are trying to encourage and motivate everybody else by telling those stories, by helping them out and fighting the disease, to telling out what mistakes they made while donning and doffing, as simple as that, because that is the most fearful part of this disease. Like if you make a mistake at the step of doffing, that might just cost a family member, a patient, or even yourself. So simple things like that. Along with it, from the government perspective, our government has been really sending out messages through all sorts of social medias to encourage the healthcare workers, as well as the police staff who is, helping out in the lockdowns. The people who are helping out on the roads to provide food to the people that who have not been, who don't have access to facilities. So I think the country on a whole is trying to fight in their own ways. It's a extreme condition. It can never be perfect. There's always more to do, but everybody's trying to do their bit to, contribute a bit. I think that's all I can say.
Thanks so much, Anna, for those insights. And it must be very hard for you as a family. As you just said, I guess it really brings things to, it really personalises things when we talk about, sitting around the dinner table, when you're all going to different hospitals, and as you know, and as you say, friends and family, that isolation, but also the fear that you don't want to be transmitting anything unknowingly. I think you really articulated that well. I wonder if Zach would like to share any insights from the US perspective. I know it differs from state to state, but obviously you're just starting your pediatric residency and your induction, and how things have been from that side.
Right, so they're preparing us pretty well. They're telling us strict guidelines of what we have to do and when or we can or cannot go in to the hospital, which I think is vastly different than what it was before, in the sense that if you're sick, and I think Dr. talked about this a little bit too, if you're sick, you're kind of just expected to tough it up. Unless you need to be in the hospital or go like as a patient, just tough it up and go. And I don't think that's a healthy way to operate in the field. Nonetheless, healthcare, we're supposed to be able to take care of other patients. And so to do that in our best, we have to be able to take care of ourselves. In terms of mental health, there have been some programs that I interviewed at when I was in residency that put a strong emphasis on mental health. And one of the ways they did that is they required you to have a mental health visit when you first arrive at the hospital. They set one up for you. And in doing that, it creates an atmosphere where everybody understands that you're going to go see this mental health professional, and you leaving to go to the appointment is not an excuse to get after work or anything like that. It's just what's expected. So to create that culture is really important, and it's hard to do. I think that's one of those things, those concrete steps that we can take to support each other and ourselves. I don't know, Mr. Ward or Dom, you guys have any input about that here?
Yeah, if Mr. Ward, if you'd like to. You'll have to unmute yourself again. Yep, you're on.
Yeah, I had a trouble with the sound. Is that at the end of what you were saying? So was there a specific question or just?
We were just talking about, do we feel that the healthcare professionals have been supported enough to work there during the pandemic and work in?
I guess so. My and our team's experience in this area has been, on the whole, the support for the healthcare professionals has been significantly improved during the COVID pandemic. A bit like Simon was saying, really, often we were under a lot of pressure. We don't look after ourselves and often not each other. But there has been a really a proactive movement, certainly by our own hospitals and our region's leadership and our own teams actually to support each other. Certainly my leadership structure is made very important in organising different rotas so that people are positive and encouraged to take time off and are supported. We've seen the reintroduction of weekly team meetings just to make sure that everybody's okay and talk through all the changes. Often, much of these things have sort of died out in previous years because of the increased pressures on the NHS. So, in many ways, it's been incredibly refreshing to see everybody working together and to work through these big changes as a team. Because of the increase in technology, we've been able to do that remotely, so increase the safety aspect of it. So from that point of view, it's been very inspiring, I have to say, and I think seeing the changes that can be brought in quickly, just when we have to
absolutely.
Do so is also quite
yeah.
inspiring. I think Peter.
Thanks very much for that, Mr. Ward.
To hear what you have to say about looking after yourself clearly it's crucially important. So we're well worth tuning into him at tea time or 6 o'clock.
Great. Thanks very much for that, Mr. Ward. I think, as you say, that need for having the right structures in place, making sure people know what their role is, but also around, I know that through your involvement with the Health Exchange Nepal, learning the lessons and sharing that globally. And I think that's just a perfect example of what we're all doing here today, with Dr. Agarwal providing us with the Indian perspective, and Zach in America, and obviously us in the UK. I think it's really important that we do share our experiences and share some of the best practice and how we can all learn from each other. So I'm really thankful that you've all joined us today. Thank you so much for giving up your time on a Sunday to be part of this conversation. I hope that you continue to engage with the sessions and the delegates, who I'm sure will have questions for you on our digital conference platform or online on Twitter using the hashtag. So thank you so much once again to our panelists.